listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart? We have with us Dr.
I am Dr. Prathusha Narela. I am a senior consultant physician, diabetes and lifestyle expert. I work as a chief consultant at Prathusha Diabetes, General Diabetes and Lifestyle Clinic, and also at MedPlus Health Services and also STX Hospitals.
Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
Most of the guidelines would define hypertension when the systolic blood pressure is more than 140 and or the diastolic blood pressure is more than 90. By this I mean that if the upper value is high or the lower value is high, both the values are high, then we would diagnose a patient as hypertension. But there are certain conditions which are exceptional. Like if the patient is already a known diabetic, the cutoff values would be less, like 130/80 in most of the cases. Even if it is more than 130/80, we need to treat and diagnose as hypertension. And whenever we are labeling the person or diagnosing the patient for the first time as hypertensive, ideally repeat readings are required, making the patient sit for a while for 10 minutes and under optimal conditions and repeating the measurement, as well as if required ask him to come back after 3 to 7 days and repeat the measurements before diagnosing as hypertension. These are the minimum prerequisites when we diagnose a person as the first time for hypertension.
Doctor, can high blood pressure be completely cured?
Actually, cure and reversal, or these are little tricky words to be honest. All the lifestyle diseases for that matter, cure or reversal is like as long as you are following the lifestyle modifications when you are diagnosed early, or when you pick up those lifestyle modifications and do them diligently, regularly, consistently, get those results. After that you will be periodically monitoring yourself and you stick on to those modifications, then obviously you are cured. But as long as soon as you come back to your old lifestyle or the habits which are not helpful for your health, again the disease comes back, or the disease or the condition or the parameters would come back to the disease state. So by this we can understand that cure and reversal are tricky. Yes, of course it can be cured as long as you are following the lifestyle modifications and regularly monitoring and being on the track.
Doctor, has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what would be the underlying cause?
Yes, of course there is an increased incidence not only hypertension and heart attacks, but also almost all the lifestyle diseases. Initially it was in 60s, later it came to 40s, now it is 30s and even lesser age group. Also we are diagnosing all these lifestyle disorders. If you want me to consider especially Indian population, there are certain risk factors which keep us at more risk for this hypertension, heart attacks and diabetes and other lifestyle disorders. Like being Indian itself is a risk factor, and there are particular reasons for that. Our genes and also the less muscle mass in Indian patients, that is called sarcopenia, and also more abdominal obesity. These are especially for Indians, and also the incidence of lifestyle disease is a decade earlier in Indian patients because of the above reasons. And coming to particularly youngsters and increased incidence of hypertension and heart attacks, definitely we have to blame the lifestyle, the current lifestyle, the sedentary lifestyle, and ordering food high most of the times outside, and also waking up late at night, using more gadgets. And one more important thing when it comes to lifestyle, stress and sleep, high stress levels, and also lesser and lesser duration of sleep, less quality and quantity of sleep. These are the major factors apart from the genetic predisposition which are responsible for increased risk of hypertension and heart disease among young Indians.
Public awareness initiative by Glenmark Pharmaceuticals.